Well, Beau Biden has faced a series of real tough health issues in recent years, even suffering a stroke back in 2010 or before. Here to break down his medical history is Fox News Medical Aid Team's Dr. David Samadi. Good morning, Dr. Samadi. Beau Biden was facing brain cancer. Let's talk about brain cancer a little bit, how deadly it is, how treatable it is, what he was facing in this 5-year siege with the disease.
Peter, as you mentioned, in 2010, he had a mild stroke, which seems to be probably not related to what we're seeing here today. He survived from that and recovered very well from that stroke. And in 2013, only about 1.5 years to 2 years ago, was diagnosed with a small mass called brain tumor and had surgery at MD Anderson. At that time, it seemed that, the recovery was full.
It's a big cancer center down in Texas,
Absolutely. Right? It's a big medical center. It specializes in cancer, and the surgery, he did well from that, and he recovered well. And it seemed that, it was going quite well until this spring had another recurrence. And that sometimes, unfortunately, can happen with these brain cancers. We see about 70,000 new cases of brain cancer in a year, 14,000 deaths from this type of cancer. And when it comes back and when it recurs, depending on what type of brain cancer, the prognosis is very poor. There's about 120 different types of brain cancer out there. Sometimes, even when there are benign masses, because the skull has no room to grow, unlike lung cancer, stomach, places where there's room to grow, with brain cancer, you would have a lot of symptoms. And he probably had headaches, nausea, sometimes loss of consciousness, seizures sometimes. So it's a really sad moment. It's unfortunate that despite all surgical treatment, radiation and chemotherapy, the prognosis is dismal, and a year usually is about the time when people die.
So it's dismal if it recurs, you're saying?
In general, a lot of these glioblastomas that we see with brain cancers, again, depend on the type of brain cancer, the prognosis is very poor. And surgery is the best way to treat it, but sometimes the location, the size, all of these plays a role, and sometimes you may not be able to get the entire cancer. That's when you have to do radiation and chemotherapy. And of course, any recurrence after brain cancer has poor prognosis.
How much of neurovascular problems are inherited? And we know there's a family history there with the Biden family. In 1998, 2 aneurysms had to be corrected in Joe Biden, then a senator. How much does family history play a role?
Well, it's a great question, Anna. And I think if you look at the risk factors for brain cancer, aneurysm is probably not one of them in the list. Genetics may play a role, but those are cancers such as von Hippel-Lindau, which is not this is not the type. Smoking plays a role. Sometimes working in certain factories, oil factories or paint factories, which I don't think he's been involved. We know that he was in Iraq for about 1 year or so, but those are probably not major risk factors. We don't really know. It's unknown in the etiology.
It's a final question, Dr. Samadi. Is it true that brain cancer is not as susceptible as other cancers to chemotherapy? The brain does not take in the chemotherapy as well as maybe other organs in the body.
Another excellent point, because there's something called a blood-brain barrier, and a lot of these chemotherapies may not get to that port. That's absolutely right. And that's why surgery, if it can be resected, and your first surgery is the best chance that you have in getting the margins, meaning that remove the entire cancer. Sometimes, depending on the location of these brain cancers, it's so hard to get to them, because by removing a lot more, you may paralyze somebody, you may affect someone's speech, you may actually cause visual disturbances. So the surgeons are working in a very narrow space, working with a very difficult cancer, and you want to remove as much as you can without affecting any kind of paralysis or motor or speech kind of defect. So
it's hard to imagine anything scarier.
Unfortunately, with a lot of these brain cancers, it's almost like a death sentence, and we're not really there when it comes to good prognosis.
But some folks do better.
Of course,
well, Dr. David Samadi,
catching it early. And you know what? Talk about that. I think if you have a headache and some symptoms that just comes, don't ignore it, because a lot of these can be prevented by getting the CAT scan, MRIs, and when you catch them early, your point is well taken, Peter. We can cure them.
Dr. David Samadi, thank you.
Good to see you.
Doctor.
Good to see you.
Sad moment.